NDN POV confronts settler colonial violence, which may be distressing for some viewers. Please watch with care.
If I could put the root cause of someone's death on their death certificate, whether that's death from type 2 diabetes or cardiovascular disease or suicide, the root cause of all of that is colonization.
Indigenous peoples in Canada experience some of the nation's poorest health outcomes, with higher rates of chronic and infectious disease, mental health challenges, and suicide. Canada ranks 18th on the United Nations Human Development Index, which measures health, knowledge, and standard of living. When the same measure is applied to registered Indians, those living off reserve fall to 42nd, and those on reserve drop further to 78th. Unfortunately, these disparities are improving, and in many cases, they're getting worse, which is largely due to systemic barriers and the ongoing impacts of colonization.
Before the arrival of Europeans to Turtle Island, our people had an intact Indigenous medical system that was severely interrupted and was not allowed to be practiced under Canadian law.
In my community, we can't eat the fish, drink the water, swim in the water, pick the plant medicines, plant gardens, because it's all polluted. And so how can we engage with the earth? How can we be well? Unless we reconcile the role of colonialism and how it affects today, we're going to continue to have the same health outcomes.
First Nations leaders entered into treaties with the Crown with the understanding that their way of life, subsistence practices, trading networks, and governing systems would be preserved throughout their traditional territories. One of the numbered treaties, Treaty 6, included a medicine chest clause, obligating the Crown to provide what we would now refer to as healthcare.
The medicine chest clause was introduced by our elders because they foresaw illnesses, famine, and pestilence that our people did not yet have medicines to. They also looked at it as a symbol of Western medicine and Western healthcare because in the house of the Indian agent, there was a medicine chest with all of the things that were used at the time to treat illnesses and disease.
The medicine chest has been broken. The treaty right to health has not been enacted to the full extent that it could be or should be. Systemic racism is entrenched in policy.
Mistreatment of Indigenous people is normalized within Canada. So it's no surprise that when Indigenous peoples attend publicly funded healthcare institutions where they routinely experience racism and discrimination, they're ignored to death, as is the case of Brian Sinclair, Joyce Echaquan, or any number of Indigenous people.
Brian Sinclair lived with a number of serious health challenges, including the loss of both legs due to frostbite in 2007. On September 19, 2008, Brian went to the Winnipeg Health Sciences Emergency Department for a treatable urinary tract infection caused by a blocked catheter. Security footage shows him checking in with triage, finding a spot in the waiting room, and patiently waiting. For nearly a day and a half, hundreds of other patients received care, while Brian languished in plain sight, vomiting and slowly dying. After 34 hours, they discovered he was not asleep but dead, and by then, he'd been gone for hours. Brian Sinclair became a national symbol of the systemic discrimination that Indigenous peoples experience in the Canadian healthcare system, but an inquest into his death reached different conclusions. Brian hadn't been properly registered as a patient that day, and hospital staff made a number of incorrect assumptions about why he was there, including that he was intoxicated or homeless. Neither was true. For advocates of Brian Sinclair, this was a clear-cut case of racial stereotyping and prejudice. However, the inquest sidestepped the issue of systemic racism and focused instead on procedural issues within the hospital. Critics have viewed this as a missed opportunity to protect other Indigenous people, like Joyce Echaquan, from similar tragedies. On September 28, 2020, Joyce Echaquan, a 37-year-old Atikamekw woman and mother of 7, live-streamed the final moments of her life from a hospital bed in Joliet, Quebec. The coroner found that hospital staff had labeled her a narcotics addict, and based on this prejudice, her calls for help were unfortunately not taken seriously.
Just because setting are comfortable also, results are good.
Joyce was obviously in distress and pleading for help. Documents show that the doctors and nurses labeled her as manipulative, theatrical, and difficult. And instead of addressing Joyce's concerns about death, the staff mocked and ridiculed her.
Identify psychologists.
When a nurse saw that Joyce was recording, she grabbed the phone and tried to delete the footage, unaware that it was a live stream. While these events unfolded, Joyce was sedated and placed in a 5-point restraint, which may have contributed to her death just hours later. Afterwards, witnesses overheard nursing staff express relief and saying that Indian women like to complain about nothing, to get stuffed and have children, and it's us who pay for it. At last, she is dead.
People were horrified about this. This was not new to anyone working in Indigenous health. Racism in the healthcare system right now is a patient safety concern.
Joyce Echaquan's tragic live stream sparked outrage across the country, highlighting the deep-rooted anti-Indigenous racism in the healthcare system, a reality confirmed by the inquest into her deaths. The coroner's report concluded that had it not been for the footage, it is likely that this event would have never come to public attention. When the system withdraws defensively into itself, that is the very definition of systemic racism. Systemic racism is insidious.
In our treaty promise to health and our treaty right to health, every single Indigenous community should have access to primary care, a family physician or a nurse practitioner every single day of the week.
Joyce Echaquan had to travel almost 3 hours by ambulance to reach the hospital in Joliet, Quebec. Many Indigenous communities in Canada lack the infrastructure and resources to support proper health care, including access to family doctors. This shortage is compounded by systemic failures of both federal and provincial healthcare systems, which often result in underfunded and insufficient services. Consequently, Indigenous peoples face poor health outcomes and a lack of culturally safe care.
The medical students and residents, they don't have sufficient exposure working with Indigenous people, particularly in community, and they don't work with allied health professionals and community-based health practitioners like traditional medicine people and doulas and midwives.
We need to rebuild the Indigenous health system with Indigenous medicines, Indigenous medical practitioners, Indigenous elders, Indigenous healers, alongside Western medicine.
While many Indigenous peoples still follow traditional ways of healing, others have chosen different paths, including the adoption of Western medical approaches. True healthcare for Indigenous communities may integrate both systems. Reviving Indigenous medical, health, and wellness systems will require substantial investment from the Canadian government, something they're legally obligated to do under Canadian and international law.
We're never going to achieve reconciliation until we have the same levels of support, resources, and funding as the rest of Canada.
My hope and my wish is we would actually be given the chance to restore our people's health with the same amount of resources that were used to try to exterminate us. Our people deserve that, and the future generations who are coming deserve that as well.